Hey, Mr. Boris, how are you doing today?
I'm doing good, thank you.
That's great. We're glad to have you here today. My name is Dr. Cherry, and I'm the clinical pharmacist here. And I just kind of wanted to go over your diabetes with you and also some of your medications. Is that all right with you?
Yeah, let's do it.
Great. So, just as a quick rundown of what type 2 diabetes is. So, type 2 diabetes happens whenever your body begins to become resistant to your insulin. All this means is that it just becomes harder and harder for your body to take up glucose, so your sugar, in order to make energy. And over time, your blood glucose, your blood sugar, will continue to increase and increase. And the longer that it's high, the more likely you are to start having problems. And these problems can be like you're constantly thirsty, you always have to use the bathroom, you're always hungry, or it could be something a lot more severe, such as kidney failure or limb amputations. And I remember you mentioned that you were rather worried about that because your mom also had that happen to her. And recently you had to deal with what we call hyperosmolar hyperglycemic state, which is just where your blood sugar gets extremely high and ends up causing some of the problems that you had, which was like being thirsty, always having to use the bathroom, but also that you were very confused and like having problems responding to different things, and that you were pretty nauseous as well. And could you explain, kind of in your own words, what might happen if your type 2 diabetes isn't controlled?
Always thirsty, constantly using the bathroom, could lead to kidney failure, losing a limb.
Exactly, exactly. So the main thing we want to discuss with you today is how we plan on helping you to avoid all those problems and to avoid that this recent incident that you had. So the very first step for that is that you need to always take your medications exactly as prescribed. So before you said you were taking your metformin, and then whenever you thought your blood sugar was high, you would take an extra. And honestly, the best thing that you can do is just take it exactly as your doctor says every single time, and it's definitely going to help you more than just taking an extra or skipping it one day and then taking an extra the next day to kind of make up for it. Just doing it as the doctor said will always help out. And whenever you were first diagnosed with diabetes, you did really, really well with it. So we just kind of want to help you get back to it. And I know you've been struggling lately with everything that's been going on, but I promise we're just here to help. So we were planning on starting you off on insulin, but you mentioned that you were rather worried about it because your mother had limb amputations after she was started on insulin. Was there any other reason that you were worried about taking your insulin?
No, that was it.
That was it? Okay. So first off, I want to clear up any doubt. Insulin does not put you at an increased risk of having limb amputations. However, like we mentioned earlier, uncontrolled diabetes will definitely increase the risk of amputations. So this insulin is meant to help you get it under control. And this insulin, as well as your other medicines, will help you get it to the will help you get your blood sugar and your A1C, which is just kind of a marker of how your blood sugar has been over 3 months. And it'll help you get that under control and in a place where we can help you properly manage. So alongside putting you on insulin, we're going to take you off of the Invokana and the Victoza. So Invokana is pretty much the same drug as Farxiga. It's very, very similar. So we just don't want you doubling up on that. So we're just taking you off of it. And then the Victoza has been shown to impact pancreatitis, and we know that you have pancreatitis, so we just don't want to make it worse. So we're going to leave you on the Farxiga. We're going to leave you on metformin, but we're going to lower the dose to 500 milligrams taken by mouth twice a day. And then the insulin that we're going to start you on is Novolog Mix 7030 FlexPen. And it's just kind of meant to cover you throughout the day, but also with your meals. So to kind of explain what this Novolog is, you're going to inject 13 units 15 minutes before you eat a meal, and you'll do that twice a day. So I would recommend before breakfast and then before dinner. That seems to be the easiest. And you'll need to keep the pen refrigerated until it's open. But once you've got it open, you can store it at room temperature, no problem, and you can store it for 14 days. After 14 days, you'll need to throw it in the trash. And whenever you plan to take a dose, so like I said, before breakfast, before dinner, you need to take off the pen cap, roll it in between the palms of your hands about 10 times. That's just kind of meant to get it closer to your body temperature. And after that, you want to move it up and down. Don't shake it, but just like move it up and down so that the insulin can mix inside. And you'll keep doing this until the insulin inside is white and cloudy. After that, you can screw on the pen needle. You can turn the dose selector to 13. So that'll be the 13 units that you need to take. And you just line it up with the pointer. After that, you can take the needle, you can take the cap off the needle, you can inject it straight into your skin. I would recommend the gut. That's usually the easiest spot to get to. And typically it's one of the best areas where you can absorb that insulin. And you'll hold down the button until zero, the number zero, lines up with the pointer. Then you just remove the needle and the pin from your skin, unscrew the needle, and throw it away in the sharps container, recap your pin. That's all you got to do for it. So just to be sure that you understood what's happening, could you go over kind of those steps for taking your insulin?
Yeah. We need to take 13 units, 15 minutes before 2 meals a day, breakfast, dinner. Need to take off the pen cap, rope to my palms about 10 times to warm it up, and then I will move it up and down so the insulin can mix. I'll wait for it to be white and cloudy. Then I'll screw on the pen needle, turn the dose selector to 13, and line it up with the pointer. After that, I remove the cap of the needle, inject it into my gut, and hold down the button until the zero lines up with the pointer. After that, I can take it out, unscrew it, and put the needle in the sharps container.
Yeah, that's perfect. And we also noticed that your blood pressure is a little bit high, and you're currently taking amlodipine 10 milligrams every day. Is that right?
I only take it really when I feel like my blood pressure is high.
Okay. Well, just like I mentioned earlier about needing to take your diabetes medicine as the doctor prescribed it, you should also do the same thing with your amlodipine. High blood pressure typically doesn't have very many symptoms, so it can be really, really hard to tell when it is actually high and when it's just pretty normal. Also, to help control it, we are going to place you on what's called lisinopril 10 milligrams, and you'll take that once a day as well. We did notice that your LDL is high, but Invokana, so one of the drugs we're taking you off of, has been known to increase LDL, which is part of your cholesterol. So we're going to hold off on prescribing a medication for it, but we may need to reevaluate that at a future visit, just so you know. And I noticed that you also reported smoking fairly often. And smoking can definitely worsen your diabetes, your blood pressure, your cholesterol, and many other diseases, and make it harder to keep them under control. Have you considered quitting at all, or now, or maybe in the future?
No, not
Not yet. Okay. Well, I would definitely encourage that you do quit. And the nurse up front will give you a pamphlet that kind of explains some of what can happen if you continue smoking, like how it can affect these different diseases that you have. And we'd also like to implement a DASH diet. So that same nurse will give you a little pamphlet for that kind of outlines what foods you can take, what foods you should avoid, and the basis of the diet just kind of revolves around limiting your sodium intake to less than 1,500 milligrams per day. Now, the pamphlet will also explain how to count your sodium and how to stay under this range, and if you have any questions, you can always just ask about it. And with diabetes, it's recommended that you lose about 5 to 7% of your body weight. So that's kind of what the diet is for, to help you out with that. And that means we're going to be aiming for about 14 to 20 pounds before your next visit. Is that okay with you?
Yeah. I've just been in a bit of a rough patch lately. I would like to lose some weight.
Yeah, and we just want to let you know that we understand you've been having problems, and honestly, we're just here to help you get back on track and to to help you be healthy and happy. We'd also like to get you to, start about 150 minutes per week of moderate intensity exercise. And I don't mean you have to do it all at once. You can spread it out over at least 3 days or even over 7 days if you want to. But just kind of getting you into exercising and working out a little bit. And moderate intensity means that you're still exercising, your heart rate's still going up, but you're able to hold a conversation pretty normal, and you don't have to suck in those deep breaths every few words to be able to hold that conversation. So a good example of this could be walking. You mentioned that your daughter plays softball and you want to spend time with her. Maybe this could be a great thing that you could do. You could go to one of her practices, walk around the ball field for a little bit while she's practicing. You'll get to see her play, but then you'll also get a little bit of exercise in while you're doing that. And maybe if she's not practicing one day, you can take your dog for a walk. I know you've mentioned how much you love being around your dog and how much he's helped you get through some of the things lately. So that could be a great way to spend time with him. And it could also even help you relax and cope with everything that's been happening. Does that sound good to you?
Yeah, that sounds great. I would love to spend time with my daughter. You know how much the little terrier means to me.
I do. You've definitely mentioned it before, and we're glad you've got a little buddy like him. I'd also like to schedule a follow-up visit with you in about a month to see your progress. Just make sure everything's okay, see if we should change anything. Is that okay with you? Do you have any questions maybe at this time?
Yeah, that's fine. No questions.
Great. If you have any questions, please feel free to call up here and ask. We're here to help you. We're here to get you back and healthy, happy, back on the lifestyle you want to be living.
Thank you.